Welcome international students and scholars. During this presentation you will hear the name Macquarie. Therefore, we want you to be familiar with Macquarie's role at OU. The Student Health Plan is OU's plan. Macquarie was selected in a formal bid process to administer the plan according to criteria set by OU. It is Macquarie's job to A. Process your completed claim in a timely manner, B. Follow OU's waiver criteria guidelines, C. Provide timely evaluation and response, D. Collect statistical data which will enable OU to evaluate and disseminate waiver criteria in order to educate international students, and E. To treat all students equally and fairly. Being a student involves multitasks. Therefore, in this presentation we are going to practice the art of multitasking. The definition of multitasking is the ability of a person to perform more than one task at the same time. Today we will be focusing on performing the following multitasks. 1. Taking the OU Student Health Plan Cell Phone Challenge. 2. Learning about OU Student Health Plans. 3. Understanding what constitutes acceptable alternative insurance for a waiver and why OU established this waiver criteria. 4. Finding where to go for help. And 5. Taking a quiz for dollars over the above topics. This will automatically make you eligible for a cash prize drawing at the end of the program. Help is available at your fingertips. Hopefully everyone brought their cell phone today. If so, please follow each step on your cell phone. These steps are not case sensitive. Step 1. Compose a new SMS or text message addressed to info@macquarie.com. Step 2. Enter in the body of the text message as shown in Step 2 and press Send. Step 3. In a few minutes you will receive a return message with helpful information which you can save to your cell phone. Your university's Student Health Plan has a dedicated webpage designed to assist you 24 hours a day, 7 days a week, with items such as accessing your benefits, printing or requesting ID cards, enrollment, viewing your personal account for payment dates and claim activity, assessing and locating a medical provider or pharmacy anywhere in the United States, other helpful links such as OU's Student Health Center. This is a sampling of benefits from OU's Student Health Plan. While your student health plan offers coverage throughout the United States, please be aware that Goddard Health Center should be your first choice for medical care, as most covered services available from Goddard Health Center are payable by OU's Student Health Plan at 100%. Please read your Guide to Understanding the Plan booklet and become familiar with the plan. It is important to note that healthcare in the United States is very expensive. This is an example of the cost of a doctor's visit at OU's Goddard Health Center compared to an outside emergency room for the same minor illness. This is not to say that you shouldn't seek emergency treatment, but rather a reminder that Goddard is on campus to assist you by providing treatment or a referral to another facility. When you or your dependents receive treatment outside of Goddard Health Center, you will need to file a claim form in order to receive benefits. Claim forms are available online at www.macquarie.com/OU. When international students and scholars come to the United States, some are already insured under a job-based employer plan or government-backed insurance plan and may be eligible to waive coverage under OU's Student Health Plan by applying for a waiver. You may view the waiver application criteria and the deadline for applying at www.macquarie.com/OU. In the past, many individual plans purchased by OU international students provided little or no protection. Therefore, OU implemented the waiver criteria in an attempt to ensure that students and the university remain in compliance with the U.S. Citizenship and Immigration Services regulations. The following are examples of individual policies and other unacceptable policies for which waiver applications were denied. In this example, there was no policy information such as exclusions or limitations provided. We will demonstrate why this is important in the following slides. The dates on this card were also expired when this was submitted. On the policy shown here, treatment for an accident or sickness was limited to 13 weeks even if the student remained insured for a full year. Any treatment after the 13 weeks period would be the student's responsibility to pay. This plan clearly stated in the highlighted portion that it was not insurance. Therefore, it is not regulated by the insurance department. The beginning date on this policy is later than the termination date. Read the highlighted portion of this policy carefully. We've enlarged it on the left-hand side of the slide to make it easier for you to read. The exclusions state there is no coverage for an injury. On this policy, coverage for automobile accidents is limited to $10,000. As you will see on the next slide, this coverage is too limited. This is an actual example of the cost incurred for a 2-day hospital stay in Norman after an automobile accident. Please note the total bill is $45,181.25. Many alternate individual plans have low limits for automobile accidents, such as the example in the previous slide. As you can see, the $10,000 limit on the individual policy would have covered only $10,000 of the $45,181.25 charge. Important contacts are listed on the last page of your Guide to Understanding the Plan, which is available online. We urge you to become familiar with the Goddard Health Center available to you as an OU student or scholar.